come in.
Hi, good morning, how are you? My name is Angela, I'm a Broward College nursing student, and today I'm going to do your assessment today. Okay, so I'm going to go ahead and wash my hands. Do you have any allergies or anything?
No.
No? Okay, can you tell me your name, last name, and date of birth?
Stacy Larson, 5589.
Okay, perfect. I'm going to go ahead and check the room for any precautions, like the bed rails, make sure the bed is all the way down and locked. Okay, perfect. Everything is close to you. Okay, so my patient is awake, alert, and oriented times 3. Okay, so I'm gonna go ahead and check your head, okay?
Okay.
Go here. Good. Okay. No signs of alopecia, no peduculosis, no lesions or any swelling or redness on the head at all. Perfect. Okay, I'm gonna go ahead and change my gloves. Put my new gloves on. Okay, perfect. Okay, so now I'm gonna go ahead and I'm going to assess your nose. Okay. First I'm gonna inspect and palpate here. Do you feel any pain?
No.
Okay, perfect. I'm gonna go ahead and tilt your head back. Go ahead and look inside of your nose. Okay, perfect. No deviated septum. Good, no redness and no signs of edema or bleeding. Perfect. Okay, now I'm gonna go ahead and test your smelling. So go ahead and cover one side of your nose. What does that smell like?
Coffee.
Okay, and then cover the other side of your nose. And what does that smell like?
Alcohol.
Okay, perfect. So cranial nerve 1 olfactory is intact. Now I'm gonna go ahead and do the eyes, which is optic, cranial nerve number 2. I'm gonna go ahead and I'm just going to inspect your pupils to see, measure them. Good. It's about a 3 on each side. Perfect. Okay. Now I'm going to see here. Good. Now I'm going to check the, let's see, go over here into my nose and look away. Good. Okay, so now I'm going to have you look far.
Occupancy.
Good. And then what does my badge say?
Broward College.
Okay, perfect. Okay, so I'm going to check each side to make sure each of them. Okay, perfect. Okay, so pupils are equal, rounded, reactive to light, and accommodation. Okay, so I'm gonna go ahead and check the cranial nerve 3, 4, and 6. Okay, so I'm gonna have you focus on my pen. Okay, starting over here. So we have olfactory. Okay, so we have ocular motor. Okay, abducens, trochlear, or olfactory. Oh my gosh! Abducens, ocular motor. Abducens, ocular motor. Perfect. Trochlear, ocular motor. Good. And then trochlear, ocular motor. Okay, perfect. So cranial nerves 3, 4, and 6 are all intact. So I'm gonna go ahead and I'm going to do your ears. So that will be the auditory. I'll go ahead over here. I'm gonna go ahead and inspect inside. Good. No redness. I'm pulling the ear up and back. Good. Okay, now go ahead and check the other side. Okay. Good, everything seems clear. Go ahead and palpate behind your ears. No signs of edema or anything, and no lesions or bumps. Perfect. Okay, so I'm going to whisper something, and you're just going to repeat back what you hear. Okay, go ahead and cover the left side with your hand.
Yep. Okay.
Right side.
Blueberries.
Okay, good. And cover your other side.
Blueberries.
Okay, perfect. So cranial nerve 8 acoustic is intact. Okay, so now I'm going to go ahead and do the face. So that's going to be cranial nerve number 7. So I'm going to go ahead, feel and palpate everything. Is anything hurt? Are you in pain?
No.
No? Okay, go ahead and open your mouth. Okay, good. Perfect. Any pain in here?
No.
Okay, perfect. I'm going to go ahead and do the trigeminal. So go ahead and feel here,
Yes.
here,
Yes.
here,
Yes.
and here.
Yes.
Okay, perfect. So cranial nerves 5 and 7 are intact. Okay, so I'm going to go ahead and I'm going to assess the mouth. Go ahead and open up for me. Okay, perfect. Okay, no cavities. Good. Everything's white. No redness, no gingivitis or anything like that. Okay, perfect. So now I'm going to go ahead and assess 9, 10, and 12. So go ahead, I'm going to have you say ah. Go ahead and swallow. Okay, perfect. Go ahead and swallow one more time. Good. Okay, so I'm going to go ahead, go open your mouth, move your tongue up and down, and then side to side. Good. Keep your tongue up really quick. I'm going to check the frenulum. Good. Uvula is midline. Go ahead and like this. Good. Okay, perfect. So cranial nerves 9, 10, and 12 are intact on my patient. That's glossophalangeal, vagus, and hypoglossal. Okay, so I'm going to go ahead and I'm going to assess the spinal accessory, which is cranial nerve number 11. Okay, so I'm going to have you shrug really quick. Good. And then go ahead and press against my hand. Good. Good. Okay, perfect. Now I'm going to go ahead and do some range of motion exercises with you. So I'm going to have you go ahead and hyperextend your head up. Good. And then extend into flexion and look down. Good. Now I'm going to have you look up and I'm going to have you go side to side. Good. And then tilt your head to shoulder. Good. And then circumduction, which is all the way around. And I'm going to have you press your hands into. Okay, good. Okay, so cranial nerve number 11 is intact on my patient for spinal accessory. Now I'm going to go ahead and assess the neck. Okay, so I'm going to go ahead. Okay, and inspect everything here. Good. Trachea is midline, which looks good. I see no signs of redness or edema, no lesions or bumps on the skin at all. Everything looks good here. Lymph nodes are not swollen. Okay, I'm gonna go ahead and assess for bruit. Okay, so I'm gonna have you lay back. I'm gonna have you tilt your head 45 degrees to the side for me. Perfect. I'll go ahead and check here. Good. Okay, go ahead and check the other side. Okay, perfect. I'm gonna go ahead and put my stethoscope on with the bell. Okay, I'm gonna check for bruit. Okay, good. Other side. Okay, perfect. +2, no adventitious sounds or bruit at all. And I'm gonna check the pulses one at a time. Good, +2. Good, +2 normal. Okay, perfect. Now I'm gonna go ahead and I'm going to assess your lung sounds, okay? Okay. Okay, so first we have vestibular, and then we have bronchial, good, bronchiovesicular, good, bronchiovesicular, and then bronchiovesicular, and then we have vesticular, good, and then vesticular, good, vesticular, and then vesticular, and then vesticular. Okay, perfect. Okay, no adventitious sounds in the front. I'm gonna go ahead and have you face the back, and I'm gonna do your lung sounds from the back. Okay, here we go. So first we have vestibular, good, bronchiovestibular, 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 vestibular, bronchiovestibular, and then bronchiovestibular. Okay, perfect. So no adventitious sounds at all in the lungs. You can go ahead and face back around. So now I'm going to do lung expansion. Okay, so I'm taking my 2 hands and placing it right over here. Go ahead and expand and take a deep breath. Okay, perfect. And breathe out. Awesome. Okay, I'm also going to do AP diameter. Good. Okay, so no barrel chest, so everything looks fine. Go ahead and face the front for me. Okay, now I'm going to go ahead and I'm going to assess the heart sounds, okay? Okay, so first is the aortic, so right over here. It's going to be right of the sternal border, second intercostal space, where S2 is louder. Over here, the pulmonic, I'm going to go ahead, that is left of the sternal border, where S2 is louder, the third intercostal space, second intercostal space, and then you have Erb's point, where S1 and S2 are equal, and that's going to be the third intercostal space, left of the sternal border. Then you have the tricuspid valve, that's fourth intercostal space, left of the sternal border, where S1 is louder. And then you have the mitral valve right under here. That's going to be mid-clavicular line down to the nipple. Right underneath, that's the maximum impulse. And we'll listen for 1 minute, and that's where S1 is louder as well. Okay, perfect. So everything seems normal, +2 for the heart sounds. Okay, so I'm going to go ahead and check your abdomen. Okay, so I'm going to have you lay on back. Perfect. Okay, so first I'm going to inspect. Okay, no lesions, no bumps, no hernias or anything. Okay, perfect. I'm going to go ahead and auscultate and listen, starting from the ascending colon. Okay, right over here. Good. Moving up the colon. Good. And I'm going down the descending colon. Good. I'm going to listen to each sound for 1 minute. And if I hear any adventitious sounds in the stomach, I'll listen for 5 minutes. Okay, perfect. Okay, so now I'm going to do the abdominal aorta. Okay, that's down, and then by the umbilicus, and then 2 inches over to the left. Go ahead and listen right over here for 1 full minute as well. And I'll be listening for bruit. I don't hear anything. Okay, everything sounds good. You can go ahead and sit on up. Okay, so now I'm going to go ahead and assess the arms and the legs, okay? So first, I'm going to look for any lesions or anything, any bruising, bumps. Good. Okay, no edema, no swelling. Okay, I'm going to go ahead and check your brachial pulses. Okay, good. They're +2 bilaterally. Then your radial pulses, +2 bilaterally. Perfect. Okay, I'm going to check your CEMS. So I'm going to go ahead and press down here. Good. Perfect. Okay. And then I'm going to do some range of motion exercises for the arms. So I'm going to have you go ahead and extend your arms out. This is going to be prone, then supine. We're going to do flexion, extension, and then abduction, and then adduction. Perfect. Okay. Now I'm going to go ahead and assess the legs, okay?
Okay.
So I'm going to go ahead and check your pedial or your femoral pulses. Is that okay?
Sure.
Okay. Go ahead here. Good. That's +2 bilaterally. Then your popliteal right underneath your knees. Good. +2 bilaterally. Good. And then your dorsalis pedis, which is right on top of here. +2 bilaterally. And then your posterior tibialis pulses. And they're +2 bilaterally as well. And also, I forgot, do you do any breast exams or any?
Yes.
You did? And when was the last time that you did that?
A year ago.
A year ago. Okay. And then, are any signs or any symptoms that might be pregnant or anything?
No.
No. And then when was your last menstrual cycle?
A month ago.
Okay, perfect. And do you get regular exams down?
Yes.
Okay, perfect. So you're all good and everything seems good. So